Welcome to SPCI 529 class. This is more like I'm just trying to give you a glimpse of what this course is about and what kind of assignment you have. That is the most important, right? What you're learning, and then what assignment you have to prove your learning and knowledge and skills. So as you know, intellectual disabilities are spectrum of intellectual disabilities we have. Not only autism has a spectrum. Intellectual disability has a spectrum too. It's from mild one to the most significant one. So it's a spectrum of intellectual disabilities. And then we usually count that spectrum by intellectual level. That is the easy one, it's the IQ numbers, right? So it's like a mild intellectual disabilities, usually from IQ 70, because it's over 70 is a learning disability. So like a 69 up to 70 to around 40, 45. And then, moderate CI is around just 45, just 50, beginning 50 and 40 something. And then lower than that is we call it a little bit profound and significant cognitive intellectual disabilities. So this class, since we are talking about mild intellectual disabilities, so it is more like a high instance of disabilities. So let's just say learning disabilities, mild intellectual disabilities, EI, emotional impairment, and high functioning ASD and Asperger's. And all these disabilities, even though students have disabilities, but they're cognitively, they can follow school education. So school education means academic education, right? With schools, we stand for academic learning. Of course, in school means there are three functions. So most important function is academic learning, academic subject learning. And then second function is a social, emotional, people practice with the same age peers. And then third one is like a safe daytime nursery role. Yes, school has a nursery role. So for 7 hours, parents feel very good and safe because their kids are in safe environment, and then they can focus on their work and whatever their just duties during they have during the daytime. So these are among three roles in schools. We call this all the time when we use the words like mental retardation. At the time we use the word educable mental retardation, trainable mental retardation. It's a very old term. Okay, we don't use this term anymore, but that is more, sometimes it's all language games, it's more communication, right? Sometimes one word is not really the great just represent somebody. However, that one word could one word can stand for paragraphs of explanation. It can save those. So I'm just like this only course purpose, I'm using this one, so don't just get wrong, okay? So all the time when we still use the mental retardation, because when I taught in the classroom, we use the mental retardation. So educable, trainable. So when they have a teacher employment advertisement, when they put it out, they said that the position name is a mental retardation, educable, self-contained classroom. Mental retardation, trainable, self-contained classroom. So self-contained classroom is the same. However, educable means the special education teacher gotta teach academic content, so mainly literacy and numeracy. So teach them to read, write, comprehend. However, the trainable mental retardation, trainable intellectual disability are for the adaptive behavior. Adaptive behavior is like as a human beings, you cannot make a high-end, very professional jobs. You cannot do that. However, your intellectual functions can take care of yourself. at least you can make a food, so you feed yourself, or you can independently. So it's like a matter of this adaptive behavior, how much assistance you need from other people, right? Other person. So you can make independent, you are home alone, and then you can set, set the food, so you just don't skip the food meals, and then you just drive out, and then you can buy some grocery shopping, or just walking distance, you have a convenience store, and then you can go there and make some small, grocery shopping, so you can make your food. So these are the all adaptive behavior. So that's the academic, not academic, but school education content. Okay, so this class is for the easy word is educable. That means literacy and numeracy. Many of our students, not only intellectual disabilities, learning disabilities stands for that, right? So that's why we call just a high instance disabilities. So learning disabilities, mild intellectual disabilities, EIs, and high functioning ASD is pretty much all about the academic content. They have academic deficiencies, academic deficits, disorders, reading disorders. So how we can teach them clinically, diagnostically. So clinical diagnostic teaching means we evaluate them like medical doctors do, right? Medical doctors, when the patient come and then, they say, just I have this headache, and then they say, so how's your headache works? So they do basic survey questions, and then they just suspect something, and they may just do image screening, or they do some, urine test, they do some blood test, try to find out the causes of this sickness. And then once that, diagnosis result comes out, and then what do? They just prescribe, or they just ask some surgery, and they do treatment, right? And then they just do progress monitoring, how their sickness goes. Is still same, worse, or better. So they regularly see this patient, doctors see the patient and check, and then if their medication doesn't work, and then they prescribe just different ones, or they do another scan or another test, and a more thorough one, more expensive one, they do it. And then they just keep treating. They don't just stop. Oh, you're sick. Oh, I'm sorry. This is for the healthy people. We don't do that. So let's compare our education and teachers. We just put the teacher's position in doctor's shoes, doctor's seat. This is why we call it a clinical diagnostic teaching. So special education teachers are clinicians, educational clinicians. Okay, so we are educational doctors. Because children came, like regular children, general children, typical children come to school, they just learn, that teacher teaches, they learn. However, our students are left out from there, left behind from that general education classroom. So they need some specialized, some teaching instructions, right? That is diagnostic instructions and clinical instructions. So that's why we call those prescriptions, it's like an individualized education program. Why? That is a prescription. If we compare to the doctor, individualized, it's not just like a general, it's a general classroom, it's just general. The teachers teach to the 20 kids and 30 children, right? And they just, they said they provide differentiated instruction, but it's not really like you could see how that's why we have students, mild disabilities, all left out from general education teaching, and then come to special education teachers. So specialized skills, teaching skills, and clinical teachers, clinicians, educational clinicians. That's our jobs we do. And then this class is for that. Okay, it makes sense. So like 583, it is obvious intellectual disabilities and cognitive impairment, and then their intellectual level, like, around 50 to below. So their educational goals and objectives are all different. and still, individualized. So that's why special education do. So again, I really hope you understood what this class is for, what we are preparing you to teach. And then you may say, some of you, if you are in the center-based program, or just a self-contained classroom for more like a moderate to below intellectual disabilities and cognitive impairment, or let's say, I don't know, what settings you are. And then you say, I'm not teaching those groups, and I never intended to teach, and I'm teaching young adult program, and I'm in the, ASD rooms. You have all different, but teacher preparation programs, we do not provide individualized education. We prepare teachers to teach all spectrum of intellectual disabilities. So you right now, current settings, you are in the, more like a moderate to severe intellectual disability classrooms, but there is no guarantee you're gonna stay there forever until your retirement. The things are changed, and then the classroom may be closed down, and then you moved to the general education classroom, and then you gotta teach those, mild intellectual disabilities, mild, learning disabilities. So we prepare at least in that, this area is a cognitive impairment area. So any cognitive impairment, you must know how to teach it. Okay, so it's the same, to the medical area. I'm just keep comparing medical area, because medical doctors, it's not starting from the beginning. Oh, I'm surgeon, I'm neurosurgeon, I'm just like a brain surgeon, I'm just like, they don't do that. Right in the beginning, they just all do together, and then once they start internship and residence, interns and residents, and then more like a specialized, and then they found their own things, right? So it's a similar. So you guys, once you are in the neurosurgeon, and then or just a cardiosurgeon, you still inside there, and you still have a specialized areas, and then you work there. But if you're a neurosurgeon, pretty much we expect you're learning wide, medical school wide, teacher professionals, school wide, you just learn from the whole spectrum. Okay, so that's why this, class you're taking. So just forget about what you are doing right now, okay, in your classroom, and you're gonna be a CI teacher. You will have a CI professional knowledge and skills to teach any children with the CI labels, diagnosis. Okay, and this class is just you will learn how to teach academics, mainly literacy and numeracy. So our students with those disabilities, regardless, because our job is not treating disabilities, our job is not moving them from disability to the just ability. It's not our job. Okay, even though we work them and we know the causes, we know the ground issues, and then we work on, and then we can bring them out. So in your reading in chapter 1, you will hear that potential intelligence and functional intelligence, the concept of potential intelligence and functional intelligence. I say this functional intelligence is most children during the cognitive developmental period, they developed. So they are still developing, because children's, human beings brain development is never end. I'm still developing my own brain functions. And recent years, while I'm writing books, I even did not know I have a brain functions like that. I believe while writing, I'm using a lot of my brain and thinking and organizing and conceptualizing, and then it really works. So human beings until death, if you are still in the intellectual intelligence work, you keep doing it using your brains in your profession, you keep developing your brains. It's the same to children. Okay, so we have functional intelligence is right now you have a functional intelligence means usable intelligence you have right now. So that's what typical children have. However, children with intellectual disability, ASD, and learning disability, all these students, even though learning disability has their IQ is a normal range, however, they have a cognitive deficits. So we have say just potential cognitive functions. Potential cognitive, potential intelligence means underdeveloped. That means we gotta develop as a teacher. We gotta shape them so they can use it. If they can use it and they have a usable intelligence, that means it becoming functional intelligence. That is my approach. Okay, how we're gonna work as a teacher, because education, we are not psychology clinicians, we are not medical doctors, still human brains and human cognitions are fluid. So we work and then we can move on. I don't know why I'm just talking this deep story. And anyway, you're gonna read those in the book chapters. So I just try to make a simple, just whole about the course design, so you can prepare your class and then your students and classrooms is ahead. You can prepare. So I'm gonna just whenever I have time, and then I'm gonna talk about this a little bit more. Okay. So let's just say next slide. Sorry, it just, I found, I opened the old PowerPoint. So this is a SBCI 529 whole course content. And it is just curriculum project. I call it, whole class is as a curriculum project. However, this SBCI 529, we are supposed to work on curriculum project and then IEP writing and then clinical teaching. So we have IEP writing as our standard assignment. You must upload this IEP writing, your IEP assignment onto live text watermark. My syllabus has those instructions and there's a clip. So if you never heard about watermark from, before, you have to buy watermark account, and just information is in my syllabus. So anyway, IP writing is about the watermark. I just tell you standardized assignment, standard assignment. So you have 3 chunks of assignment in this class, and this is online class. So you are not gonna go with me in the hands holding it, and we can walk together. I just made the whole design as much as I can, not to confuse you. Okay. However, human work, always there are, holes. So you will find some, holes and hurdles, and then please feel free to let me know. Okay, I'm gonna just right away just check and then just revise and let you know. So knowledge learning, pretty much you have a chapter readings there, and then you will demonstrate your reading outcomes, and it's a summary. You can do a paper summary, or you can do PowerPoint summary. You can do just like me, just like you can open the, Zoom or something, and then you just each section, what is this chapter is about, and then each chapter sections, titles, you just talk about it. So you have 3 options. Most of students choose a paper format. So it's the easiest one, and you use the, course. I just have a long, guidelines about the, how the summary makes. Okay, so you can check that later. And then you have IEP writing. IEP writing, you're gonna do very special preparation. So you will do data collection. This class has 30 preclinical hours. Preclinical hours requirement. So it won't take 30 preclinical hours. However, since you have a preclinical hours, I'm giving this assignment. So all just like a data collection templates there, and then you will say, oh my gosh, in school, we don't do this much prep, but this is exceptionally, I made it so you guys can understand what kind of, cognitive part you have to check. So you will read the book, and then the book chapters, it's just selective chapters because it's since only 7 weeks, I cannot ask you to read the whole book, and then you may buy just like a course packs book. You could do it, but I just selected the book and then give you free. However, this is not copyrighted content yet, so I made it just like a not printable, so you cannot print that content and you cannot download the content. I believe you can download, but I'm not sure you can save it or you cannot copy and paste. Okay, so please just don't use other than this course content and just all guidelines there. So anyway, that's data collection. It's all templates there. It's very heavy, comprehensive data collections. So you learn the whole spectrum of the cognitive part and academic part, and then the other cognitive domains you gotta look through. So you're not gonna learn this kind of content from any other classes. So it is a very, very unique opportunity. So instead of saying, oh my gosh, I'm dying, and then just I really hope you enjoy and appreciate this much information you have opportunity to learn. And then chapters ahead there, so you can see it's all just chapters are helping this assignment. And then once you do data collection and then you organize data, like functional behavior assessment types of, you organize the data and then you put that one as a PLAB, and then you will develop goals and objectives. So you will do one child, but I'm going to explain that a little bit later. And then the third one is clinical teaching. So clinical teaching is a real teaching. So diagnostic teaching, as I just explained with the doctors, that's what you want to do. But here, most of clinical teaching is like a medical doctors do. You just assess the child and then you plan. So that means just after this assessment, that's like a PLAB types of assessment. And then you, based on that, you just develop, IEP or just instruction, right? Diagnostic instructions you develop and then you implement. That means you teach it, and then you check evaluation. You do evaluation. That means progress check. So progress check is not just monitoring. You really do data collection, and then you revise, and then you plan again, and then you teach again. So these are the diagnostic teaching is a cycle. That's a special education is for. That is the special education is for. So you're gonna do this, and then this clinical teaching is just like a let you experience what chaining, because I talk about task analysis, chaining, shaping, and spiral teaching. So pretty much shaping is just through spiral teaching. Spiral teaching means it's not just like A, B, C, D, every day you teach different things. So you kind of pile up. You just, when you build a block structure, you put the base, bed block, right? Baseline, and then you put the next, and then you put the next. So building blocks, that is spiral teaching. That is clinical teaching. So this book, I assigned you a book, and so you got these three, right? So next one, let me see, it doesn't work. Oops, no. Yeah, so like this. So I already explained this course design and 3 sections ago, and then this is the book you wanna buy. I did not assign this one as a textbook because you may just go to Amazon and buy used book. It's not expensive, but it's a one book curriculum. Real reading mastery is like a several $1,000, very expensive one. This book is a condensed first and second grade together. No, not first grade, but it's early literacy. So pretty much I used this book a lot, and this book you teach it, and then child, if you can do spelling as well, not for this assignment. This assignment is only for the teaching. So you don't have to do comprehension. You don't have to do, handwriting. You don't have to do all this. This book is just combined all those, English language art. But this is for only literacy, remedial education. It's a perfect, curriculum. So once you use it, get to know about this book, and then, you have some, grant money, or your principal has some money, you may ask your principal just buy the regular curriculum. It's like when I taught in late 1990s, early 20s, at the time, it's like a one box, one grade, the curriculum was over $1,000. But my principal graciously bought this curriculum for me. And then I really to be honest, every single child with intellectual disabilities learned to read through me. So I felt really proud of myself at the time. And that is really make your passion continue. You gotta see your teaching from your student. It's amazing experience when you do pre-test and they just read nothing and barely count to even 5. However, you teach, and at the end of a school day, and then for the summer, you see them, and then amazingly they could read and they finish in this level, and then that is what you did. That much you impacted that child feature and the child, right? And then you just have these children taste about themselves. I can do it. That amazing feeling, you gotta see it, and then you gotta see their eyes and the sparkles there, because it's amazing experience you see, and I'm very excited. Still, they will be in trouble once in a while. However, you much can manage their behaviors with this teaching. So anyway, this is just a one book curriculum, because this Engelman graciously made this one book curriculum for parents to use. So it's amazing, several $1,000 curriculum in a book. It doesn't have a storybooks, but it still has a story. And just like you will learn from, through this book, what clinical teaching means, what shaping means, what training means, what spiral teaching means. So these are all scripted curriculum. So you read the guidelines, get familiar with this, and then blending is very important. The sounding out, blending, and very important. I'm gonna make one clip about it and separately another time, or just I just probably had tons of clips in YouTube. I can find mine, and then I can just add there. So that's you're gonna teach it 20 to 25 lessons. So if you find a child in your classroom, let's see if it goes down, but not really. So come on. Yeah. So this is a child search. I know many of you are in the classroom setting right now, teaching and young adult program, or just a high school, more moderate to severe classrooms. However, since this class is, as I said, this class is a different, it's a different, goals and objectives. So, and then the teacher preparation program. So you are learning to teach how to teach mild CIs, mild intellectual disabilities. So if you are in the classroom, not mild, more like a moderate to severe, and then you have to get out to your classroom and find the time and teach and screening those data collection for the PLEP and IEP, and then this clinical teaching is all go one child, same child, okay? Same child. So you do PLEP, data collection on a child, and then you just do IEP goals and objectives, and then you're gonna teach clinical teaching. That is the sequence and pathway. However, you have only limited time, 7 weeks. So that's why you may, do all together. IEP, you gotta wait. So data collection and then your teaching could go together. It's okay, because we have a limited time and we cannot have that luxury to go you finish this one and the next step and the next step. We don't have time for that. So that's why I'm just giving you this early. And if you, do, child in your classroom, student in your classroom, and then you have more time because 20 lessons, you're gonna do 2 lessons per day. And then 2 lessons per day. And then if you teach every day for 5 days, you just need 5-10 minutes. That's all to teach these, lessons. Just 5 to 10 minutes. So if you drive out and just to some other schools because you are in high school, so you go to the neighborhood elementary school and do this. I rather do data collection and then I just have about 10 minutes with the child one-to-one and do this clinical teaching assignment. Okay, so that's the best one for your learning. This is all about your learning. Of course, you're going to teach all spectrum of children. So, she doesn't understand, who we teach. I know who you teach, okay? I'm talking about to make a successful course learning and then assignment and then grade. So best your learning outcomes. If you have a child K through 3rd, any of those early elementary primary level children with a mild intellectual disability or learning disability in inclusive classroom or general education classroom or resource room, and then your life doing this is much better. That's what I'm saying. Okay, so it's more like a target and then you don't have much struggles. However, let's say you do high schoolers, middle high schoolers, young adult is not. Okay, your license, even though Michigan has a young adult program, your endorsement is a K through 12. So young adult is like a continuation of a 12th grade. So that's your endorsement, but all this assignment, young adult is not appropriate at all. High schoolers, to be honest, not appropriate either. Okay. However, if you have any high schoolers with some severe literacy issues, especially in a very basic sound discrimination and just blending, sounding out, even regular word, like you just know the sound, you can blend and then you can read. That's what we call regular word. So you have those child, you can try. And best candidate is young children. And 4 years older, so you could do it. However, that 4 years older, so not moderate to severe, not Down syndrome, and not that level. So again, eventually you will teach all those children and then you can teach reading to them. I taught reading to a very severe ASD child and she learned to read and write and she could write and she see the picture and then she just writes about the picture. She could learn that much. That's what I'm talking about, the potential intelligence, how much you move those potential intelligence to functional intelligence. So able teachers could do that. It's like a medical doctor. So we have all tons of different types of doctors, different ability doctors, right? Teachers are same based on their experiences and then who they taught. They could have different capabilities. So more like, as you see the professors, we are teacher educators, you could see just like teacher educators are more seasoned teachers, right? I'm competent to say that, yeah, I can teach any child, bring them, and even, IQ is 40, but not intellectual disabilities like Down syndrome. However, like ASD is very vague, their IQ 40, still it's not real IQ 40. It's more like a huge part is a potential intelligence, and any human adult, not human adults, but any adults could not bring their, work on them and then bring that out of their potentials to the functional levels. So that's why I just, taught the girl for, that. So I saw that. So I see, because I've just like experimented to see really autism, really that, low levels, really they don't have enough, intelligence to learn these literacy and numeracy. That was my curiosity. And then I tried, and then I saw that it's not. It's all their artisan piece really have them really just stay inside. So not many people could see their inside. So that's the one. So, and yes, so one classroom, if your classroom is for these students, yes, feel free to, you can do it, and then you can sign the log. And if you really cannot find any, and your job is really changing, very difficult, and then you need some modification, not assignment modification, but some accommodation about the child, and then please just contact me. Okay, and then we can brainstorm together and based on your situation. My interest is your best learning as much as you can. And 100% you cannot digest what I try to plan to teach. Is still just like, let's make, independent level, instructional level. Have you heard that? Independent level is 95% of instructional content the student learn, and instructional level is 90%. So lower than instructional level is all frustration level. Okay, that's how we measure students. So same, those, degrees I apply to college class, and then I really hope most of my students are independent level. Okay, not just below instructional level. And these are the, next one, these are the, main, those knowledge learning. This will be the chapter learning. Is it's not from one book. I have 2 books. I just selected the books. As I said, I didn't make just a book and publish it, and not just through even, course back prep, company, we could publish it, and then we could just use it as a course pack, and you guys just pay and buy it. But I just decided to give you this one for free, but you cannot download, you cannot print, you just have to use your screen to read. So it is just a summary, and then at the end you provide the insight, perspectives, beliefs. You can use your own experience and then connect it to the book content, book chapter content, and then you just could write and talk about it. And then you have a data collection we talked about, and then you have a IEP writing. So this data collection is for the PLAP, and then you're gonna do, I think, where does it go? I think I skipped this explanation. Where is it? Yep. Here is also, IP goals and objectives. So these PLAF you do data collection, and then you analyze. This will go to your IP goals and objectives. So I gave you 10 sets of goals and objectives. So one goal, and then you're going to have 4 objectives. So 1 goal and 4 objectives. So based on your data, the child will have an incredible number of countless deficiencies. So you're going to pick 10, and then this is just a practice, and it is different. Don't just obsess about what your school district do. Okay, I'm just gonna teach you the very standard one, and always we teach. There is no way I can do just like, what is a custom made teaching, and you are in this school, this Ypsilanti, you are in Ann Arbor, you are in Winchester. I cannot do that. We are doing all standard what IDEA says. Okay, so what goal means, what objectives means, you will learn those. Okay, still you go back to your school, so still you have a broader, it's like an encyclopedia, knowledge, and then this school district asks to do this, and then, okay, I can modify, and then I can do it, and then you move to another schools, and okay, this another schools ask this, and then I can do this. Okay, so that's a variety of learning, what learning means. And do I learn all this from my, teacher preparation programs? Not really. While I'm just adding experience reading more books and then preparing my, pre-service teachers. So it gives me this much power, knowledge power, and the insight power. So you guys are learning all this spectrum of things. It's not the However, your experience years ago, and then you will just pile up more experience, more knowledge, and then more skills. So, and then someday you may want to go to the higher ed and teach, who knows? So that's IEP writing, and then clinical teaching, here. Okay, so I think IEP I just skipped, but it's just a glimpse of what this class is designed, the format. I'm just introducing. Okay, so don't be panicked yet. So Canvas has all this information, and then you're gonna learn this. Okay, pretty much this is all about the class content. This is more like a technical one about the must know and do. This is a Canvas. I believe you are very now expert and know how to use Canvas. However, every professor have a different design. Some of them is more functional, some of them is not organized, all kinds of Canvas, and then I'm still experimenting a lot of things. It's just like a customer service. I just try to see my students without hassles, how they can find the information better. Okay, so like please put the instant notification so you can receive any comment I gave you, any announcement I gave you, you can receive right away. Even though, you gotta see the phone and see, and then later you can open the computer and check. Okay, and these are the pretty much basic icons. This is hyperlinked any lectures. It's a hyperlink icons, and then this is like a paper, right? So more like a knowledge information, we give, and this one is a submission assignment. So it's like with a pencil, that means you gotta do something. And then in your first and only quiz in the beginning, you're gonna take is instructor's policy and rule in the syllabus. Please read it, and then you say, I thoroughly read it, and that means you and I, it's a mutual agreement. So I assume you understood, and then you don't get any just point card in rubric. So other than those assignment directions, you have to check every assignment has a rubric. So please check those rubric. Okay, so these are the I should not talk about this. This is really for the undergraduate and early 20s. However, you're graduate students, but I'm still just think about self-discipline a lot myself, and then time management a lot. So it's all about your life, how you can be function. Let's say we are all doing multitasking, right? Right now, I'm just only having this college jobs. However, this college job, I have to do professor job, I have to do researcher job, I have to servicer job, and then now I'm just doing one coordinator in one program. That coordinator work just like really eat me all over my time and very time consuming work. So how can I manage all this work? So you don't have to higher order cognition, higher order thinking, metacognition. You don't have that. There is no way you can handle all this. That is time management and the self-discipline and the organize the stuff. So like, right now I'm giving you this glimpse of, what this class is about. I'm giving you this. This is one of my higher order thinking. Okay, let's do this. And then each assignment, I'm gonna make a little clips, and then whenever students have some important questions or assignment, when I grade certain things that came out, and then I'm gonna make a short clip. So instead of just giving you long emails, I'm gonna make a clip, so like a 5-minute clip, 8-minute clip, 10-minute clip, and then you don't have to see me. You just can just listen, and while you're driving or while you're cooking and set the dinner, and you can I'm sorry. You can listen, so you can have just like a preview, and once you have quiet time and sit down, and then you can just listen again, and okay, that's what she said. Okay, I did my assignment incorrectly. So I usually say just like, oh, this is the first time, so you did this, so some of you misunderstood, so you can revise it and resubmit. And some people really just upset about it. Some people just like really appreciate it. It is all your choice. My job is giving you opportunity, chance to resubmit, and doing just revising or not, it's your job. and then your choice. So you revise, it means you want a better grade, even though you don't know what grade she gave me, or she gave me this grade and you cannot accept this grade based on how much time and work or effort you put. And then you're gonna revise it so you can receive, you deserve the grade. Okay, so that's all we do. Just like I do my part, you do your part, and then we can just do together. So that's pretty much all. And I'm just to let you know, this is my, what do we say? It's like, it's not just, principle of teaching and learning. It's, this is my passion and my goal. So prepare competent teachers. So my goal is not just to prepare you because you came to special education to do some meaningful work, to do some meaningful things to change children. It's very vague, right? And then many of you came to teaching field, especially MAT. Your undergraduate is not teaching. However, you did some work and then you just, okay, teaching could be the best fit for me. And then you came to teaching field. You chose special education. Some of you may just, because special education is more the demand, most available area, most just open vacancies. So I could apply better. So without putting that much meaning about what you teach, you just think it's a teaching. It's the same teaching. So that's why you came here, and then it's okay because not everybody knows what you're gonna do and then choose the profession. You came, however, to enjoy your job, you gotta be competent teacher. The competent teacher means you are very competent about yourself. And you are competent because I'm the smart one. I worked so hard. I know how to teach children. I know how to children's diversity. The diversity is not just like a physical diversity, but inside the brain diversity, neurodiversity, and you know all these. Okay. So, and then you feel competent. And I'm super teacher. Okay, any child bring to me and I can teach it. If you have, so teaching is two things. One is a behavior part, their behavior management part. The other one is a curriculum and instruction. So you teach clinical diagnostic teaching, we call it a remediation, and many people use intervention. I don't use intervention. Special education is not for the intervention. We do not intervene, their difficulties. It's not right term. Special education is for clinical diagnostic teaching. Okay, and then what we use, task analysis, training, shaping, spiral teaching. In between, we just, that's why you just, school psychologists evaluate our student, and you do not know, you only see the outcomes, the result, the visual perception, literacy, phonological awareness, phonemic awareness. You never tested the child. So that's not right. Clinical teacher, diagnostic teacher, you do screening yourself. How? Not through testing. You teach them. And then you know them, what they are missing. That's what I try to teach it through this data collections. That is a screening. You are screening the child because that's not standardized instrument. However, those checklists covers most of the functions under attention, under sensory processing, under perceptual processing. I try to cover all of them, very detailed, very overwhelming amount. However, each one is what students need. Any of the holes there, they cannot move on in school education. Okay, so I just made those checklists for 3 years. I'm revising and updating, so it's not complete one. And I'm just, you just read through honestly, okay? Read through honestly, and then it will let you understand the children's brain function a lot, especially you are in cognitive impairment areas. And then believe me, cognitive deficit, cognitive part is the everything and whole disabilities, or IDEA 13, 14 disabilities. Any child that has a disabilities, even learning disabilities, their IQ is 130, 140, still they have cognitive deficits in visual attention, visual perception, perceptual discrimination. That's why they have a dyslexia, they have a dysgraphia, because they cannot see the clean, okay? Don't see the clean line, clean form. So it really prevents them to read, learn to, read. So this phonics, your clinical teaching, the real curriculum, a lot of part you do correctly, and then you can really shape, remediate those their dyslexia part. Many people said they have dyslexia, so they cannot learn to read through phonics. No, phonics is a part of a clinical, I don't say treatment, but clinical teaching. You can recover, remediate their cognitive, that visual attention. It's a visual attention. You will read about the visual attention in your knowledge learning. Visual attention and perceptual process is very, very important, chapters to understand the cognitive impairment and cognitive deficits, and understand the ASD and all other spectrum of disabilities. Okay, so please study honestly. In 7 weeks is very short time. But if you ask me, and then I have just tons of my lectures there. And if you just, okay, whenever you drive, and I have an accent, as you see, however, while driving, while cooking, while doing cleaning, and I always do multitasking. So when I cook, I still listen to something. It's not just drama. I listen to, some monks' lectures, philosophers, and neuroscience, I just learn those through, and then it's more like a reinforcement. To me, I read it, but still I forget because I'm not, science person. However, I just listen once, twice, 3 times. I just learn it. And then you learn more, and then you feel more powerful, more competent. So that's why I say it's a competent teachers. That's your goal. It's not just a teacher for the paycheck. Okay, you gotta be a competent teacher. One competent teacher can save 1,000 children's lives. Okay, because we are teaching not general population, general children population. We teach children already left behind. So they don't meet good, competent special education teachers. Their life will further behind each age grade more and more. And then age 30s, 40s, and 50s, you can imagine what kind of a life they will make. So please, you chose the most critical God-given jobs you chose, and then prepare yourself for that. Okay, prepare yourself for that. Okay, it's for your own integrity and dignity, and then your children's. Okay, so that is my message. I'm sorry, I just kind of intensive, but that's who I am, and this course is about. I really hope in short time you can make all these just as much as you can. Okay, again, I'm with you, so feel free to contact me with any questions. And I made 8 to 9 p.m. It's my student meeting time. So, that is your quiet time pretty much. So, even though you have young kids still, by the time after dinner, they do their own things and you can have a quiet time. So, just any questions, so just let me know, and you need a, appointment, but I just cannot give you guarantee. I cannot guarantee, you can just choose the date you exactly need. Sometimes I have appointment because I teach multiple courses, and then I have a coordinatorship. So there are about 60, 70 people students I'm working on. And so but 8 to 9 is I just set this time for my students, so we could talk, okay? And this is it. I'm gonna stop and I will see you, I made another, short my face, welcome clip. So, you can watch and see, we can see that too. Bye.